Venus, your chamber president, and I'm here with Dr. Misty Farr, pharmacy manager of Walmart in Florissant. And she's just got some tips and just some information to share with us that you can do at home for your business during this crisis. So, Dr. Farr.
So, hello everyone. As Venus said, I am Dr. Misty Farr, pharmacy manager for Walmart, and I am your 2020 chair of the board. Yay! So, we come to you today to speak a little bit about coronavirus. I know that a lot of people are confused and scared about what's going on and seeking clarity. So, coronavirus isn't a new thing, but the COVID-19 strain is. So if you, MERS and SARS, if you remember from years ago, they were both viruses and they were in the coronavirus family. So COVID-19 sounds pretty scary, but COVID-19 is just the abbreviation for what it is. So CO, corona, VI, virus, D, disease, 19, it was discovered around December 2019. Mm-hmm. Yeah. Mm-hmm. So that's where the COVID-19 comes from. So coronavirus can cause respiratory infection, in which it becomes difficult for the individual to breathe. This is in severe cases though. And when we speak of viruses, we have to kind of think about them in terms of symptoms. Because different viruses cause different symptoms. Reported illnesses for confirmed cases of coronavirus, COVID-19 rather, range from showing no symptoms to mild symptoms to very severe cases and sometimes even death.
So I have a question, Dr. Farr. So a lot of people have this misconception that younger folks are going to be just fine, and that they don't need to do social distancing, to think about, the repercussions that it might make, because they feel like, well, I'm young, I'm in my 30s, I'm fairly healthy, but isn't it good for them to still practice?
Yes, everyone, including the very young to the very old, should use best practices. So even though I'm a very young person, and usually younger people are healthier, what if I don't know that I'm sick? What if I am not displaying any symptoms of my chronic illness? Sometimes you just don't know until you go to the doctor and you get diagnosed with something.
Right.
So, better safe than sorry in this case.
And even there's a lot of people that have asthma.
Yes, that's true.
There's a lot of people with autoimmune. There's a lot of, just like you said, some illnesses that haven't showed their symptoms yet. And so I think it's just best practice to listen to social distancing.
Of course, washing your hands for a full 20 seconds. I have my children to say their alphabet twice, and I have them say it twice because when they start to sing the alphabet song, they get into it and start going really fast. Yeah. I'm like, oh, go ahead and say it one more time. So, of course, washing the hands is very important. Cleaning surfaces. Yeah. When we think about washing hands and cleaning surfaces, it's something that we should be doing anyway, but the COVID-19 has definitely brought that about to be more frequent now.
So is it airborne? I've been hearing a lot of different conflicting information that it's airborne, it's not airborne, how long it can last, and how long, what precautions you should take.
So I will tell you from the research that I conducted from WHO, from CDC, I found that the virus is spread through the droplets. So if someone coughs, sneezes,
so it could be airborne. It could,
but you have to be close. You have to be close enough to come in contact with those droplets. That's why they asked us to practice social distancing, because, for instance, right now I don't feel like you and I are the appropriate amount of space, far from each distance from each other.
There we
Because
go.
if I were to sneeze right now, even if I sneezed in my bent elbow or coughed in my bent elbow, which is best
Right.
practice, I mean,
I could still get your
you're
germs.
close enough to
Right.
still
So
come into
social
contact with my
distancing
droplets.
is really important.
It's most definitely important right now until we figure out exactly the parameters around.
So we
COVID-19.
definitely don't want to have people panic, but we want to make them just aware and.
Yes, I think panic has panic is.
And I am so prone to touching my face.
I am
It's
too.
just such a second nature to me. So, and I talk with my hands.
Mhm. Yeah, we as a community are panicking. If you visit your local grocery, your local Walmart, your local grocer, should see bare shelves, no toilet paper, no hand sanitizer, mask. We have panicked, and having those items are essential, but hoarding those items, I don't think is necessary
Right.
at this time. I don't feel like the world is
but
coming
there's
to
hope.
an end.
There is hope.
Most
There's not.
definitely.
This is not like World War Z and
Exactly.
bunker time. If you have a bunker, you have room for one, or actually three. I need room for my kids. So if you have room for three, and I'm really fun.
Yes, you are, Venus. You're tons of fun.
So, but it's not doom and gloom. There is a light at the end of the tunnel. There's definitely different medicines that they're trying to use.
Yeah, there's quite a bit of research being done
Conducted,
now.
yeah.
So we just have to kind of wait and see, but definitely if you have knowingly come into contact with someone who has tested positive for COVID-19, that 14-day self-quarantine is a must.
So what are your tips? Like what medicines should people have in their pantries, or like what things that, we don't want people to hoard, or we don't want people to panic buy, but there are just some things that
some
you
things
should
that you
have around.
some things. So, pain or fever reducer. So that would be acetaminophen. Most people know that as Tylenol, or ibuprofen, which people know as Advil or Motrin. Those are two things that you should definitely keep in the house for just in case for any time.
Yeah.
A cold medicine. In my house, my family's favorite cold medicine is Dayquil, but there are several other things out there.
Right.
You have Alka-Seltzer plus cold. You have
Robitussin.
You have the all famous Father John.
Yeah.
So there's several.
And are there some like home, a lot of people have been texting me about apple cider vinegar and.
Well, I don't have any. I've not done any research where
On those.
apple cider vinegar has helped with a common cold or anything like that.
But it is
popular
immune, yeah.
It's popular for things like weight loss and general health. But
General health.
I cannot swear by it at all. I
I cook with it.
Oh yeah, definitely. It tastes good
On like some chicken adobo.
Exactly.
But, yeah, so, okay, well, cool. Thank you, Dr. Farr. Is there anything else that we should know broadly?
No, just keep yourself safe. If you experiencing any severe coughing, shortness of breath, contact your medical professional to see if they think you need to head to the emergency room. We want to save the emergency rooms and the doctor's offices for those who are sick so that they can be treated right now so that we can reduce the spread of the COVID-19.
Well, thank you. Thank you for your expertise. I'm sure everyone appreciates all your hard work, and you guys are still working.
Oh my goodness, yes.
Around the clock.
Yes.
So thank you for all that you do for us and the community.
Oh, thank you.
But also just, thank you for we shouldn't be panicking.
We should not.
We should also practice,
best hygiene practices.
social distancing, absolutely. This is not time for house parties.
This is true.
This is not time. Yeah.
Be aware, be concerned. But
Yeah. Yeah. And be conscientious of your fellow man. I think that, this can either bring out the best or the worst in people. So
I've seen a lot of both so far.
Yeah.
I've seen a lot of both.
So North County, we're here for you.
We are, most
And then if
definitely.
you have any other questions for Misty, just email it to us or write it on the comments and we'll get it to her and we'll get you an answer. All right.
Take care.
Thank you.